Hey everybody, welcome to Shining Waters Yoga. This practice is going to be a practice for knee health and to strengthen the muscles around your knee as well as to stretch for flexibility. A lot of my clients that I work with have knee issues and that can cover a lot of different things. I've worked with people both pre and post knee replacement surgery who've had like severe arthritis and ended up needing knee replacement. Working before surgery to strengthen those muscles for a faster recovery, and then working post-op once they're cleared by their doctor or physical therapist to begin exercise again to help increase range of motion. So typically you'll go through your physical therapy if you're having surgery for so long, and then when the insurance says, hey, you're done, or your physical therapist says, hey, you know, you've achieved your goals, you might still want to increase your strength and balance because the knees are just, they're such an important, all of our joints are so important in our bodies. And as we age, unfortunately, we tend to have some degeneration. A lot of us deal with arthritis. And then of course there's things like meniscus tears and ACL tears and all those fun things, especially with athletes and people that are really active. But any of us can be susceptible to those things. So the first thing I want to just be really clear about is if you have unidentified knee pain, please, please, please go see your doctor, get some x-rays, some information about what it is you're dealing with, right? That's always the first step. You don't want to mess around with knee pain. Once you know what you're dealing with, then of course you get to make choices. Maybe you don't have arthritis so bad that you need surgery, but you just need to be careful and aware of what's going on. Full disclosure, I do deal with arthritis in my joints. I know I have some in my right knee, as well as some IT band inflammation that bothers me. It creeps up now and again. So I'm always really careful with my own knees. And a lot of times in yoga, my classes included, we do the all fours where we're on our hands and knees. And for people with knee pain, sometimes that's not accessible, as well as deep knee flexion, right? Seated, whether cross-legged or even the kneeling in Virasana. Fortunately, I'm able to do those things, but a lot of people are not. So this class, we're not going to do any of those things. I will show you just one little helpful hint if you are able to do hands and knees. But mainly we're going to concentrate on strengthening the muscles around the knee joint. As with anything, as I mentioned, make sure you know what your pain is. Do as your doctor says. Avoid anything that you're not supposed to be doing. If in doing this practice you have any sharp pain, please don't do it. So again, lots of different things that you could be dealing with, everything from meniscus tears to arthritis, and they're different things. So with that being said, props for today's class. If you have a blanket or two, and most of us have a blanket around the house, it doesn't have to be a yoga blanket. It is helpful if it's not too thick. So the nice thing about yoga blankets is they're not terribly thick. And we can go ahead and fold it about like this shape. And then you're going to make a roll with it. So rolling it the short side, not the long side. And then once you get that little roll, like so, set it aside because we're not going to use it just yet. If you have a strap that you can use, that's great, or a dog leash. If you don't have these things, or belt, go ahead and practice with me today. You're going to see how I'll use them. I'll give you other options, and then maybe you might want to invest in a belt. I also have a little physical therapy elastic therapy band. So if you have one of these, this is great too. We're only going to use this for the very beginning, so for our feet. So it's always nice to start with the feet when we're working with the knees, and we're also going to warm up the knee joint a little bit. I am seated on a folded blanket just to help tilt the pelvis forward, because one thing we want to do in a lot of the exercises we're doing today with the knees, make sure we're not rounding back into the lower back. I also have some herniation in my lower back. And if that's something you're dealing with and we're doing all this work and we start leaning back, you're going to end up with a sore lower back. We don't want that to happen. So I am sitting up on just a folded blanket. You can use a cushion if you have that, but not too high. Just a little bit of support. And then I'm going to start with taking my therapy band around my feet. And we're going to warm up our feet a little bit. Also using the muscles in our legs. So I've tied my band so that my feet are just about hip width apart. So thinking about standing mountain pose when we stand in mountain pose. And then I'm gonna do a little eversion and inversion. So we've done this before in yoga classes, turning the feet towards each other and then really concentrating on the eversion away from each other. So just doing that a few times. Noticing perhaps, if you're dealing with knee pain maybe only on one side, notice if that foot maybe has a little less range of motion or if there's any soreness as you evert, turning the toes out. And you could do like a couple sets, maybe 2 sets of 8 or 10. I usually go for 10. So we'll do one more set, turning in and out. My band's getting a little bit loose here. It should have a little bit, not quite so much give. Should be a little tighter than that, but this will work for today. You can always tie it a little bit tighter. So I'm going to stop there and I'm going to go ahead and do some flexion. And again, I'm going to use this band. Now, if you don't have the band, you can do it without the band, right? We're just turning the feet rather, in and out. But make sure that you try to keep the movement localized and you're not engaging the muscles of the leg too much. You're going to feel it here. But don't try to really use the muscles of your feet for that action. And then the other thing I would do is flexion. So I'm going to hold on to my band and I'm going to try to point my toes and flex. So pointing and flexing. And again, the band just offers some resistance. So if you don't have the band, you're just going to flex and point your feet. Make sure you're still sitting up nice and tall and you're not sinking into your lower back. So we warm up the muscles of the feet. You might even feel this all the way up into your knee. Another really great thing to do to warm up your feet is to just roll on a tennis ball, 1 foot at a time, of course. I thought about including that today, but that takes some time and I really want to dig in to knee movement. So we'll go ahead and stop with that and set that guy aside and come on to your back. Put your little cushion aside. We're going to come all the way onto our back and do a little bit more motion to warm up the knees. Have your strap nearby. We're going to start with a little somatic movement, and I'm going to do both sides. So we're going to assume that we want to do this on both sides. Feet are in line with your knees. We're going to do this little painting action. So pretend that the sole of your foot has paint on it, and you want to paint on the floor with your foot. Now, it's easiest to do this with socks on if you're going to be on a sticky mat. You could also be on a carpet. It's a little bit easier to slide. We're going to actually slide the foot forward and then bring it back. So you slide the foot away from you and then bring the heel back in towards your glute. And as you do this, don't let it come so far away from you that the foot starts to come off the floor like that. So you want to keep the sole of the foot in contact with the floor, just sliding it out. And the focus here, notice what you're feeling in your knee.
And that's enough that way. Now we're going to go side to side. So we're going to paint the floor this way, taking the pinky side of the foot out. You might feel that in your hip joint, and then back in towards the other foot. Out and in. And again, don't move so far. You can do this movement nice and slow. Don't move so far out that the pinky toe side starts lifting off the floor and the knee is caving in. You want to keep the sole of the foot down on the floor. And then we're going to put those two movements side to side, forward and back together and make a circle. So imagine that you're painting a circle on the floor with your foot. And I do like 4 or 5 circles and then change direction and go the other way. And you might really be feeling this in your knee joint right now. And then pause and we'll do the other side. So again, if you've only got an issue on one side, you might be doing this just on one side. I'm going to do both today. So taking the right foot, slide it out away from you, but don't let the foot come off the floor, and then back in. So you're making a straight line, painting the floor. And doing this really slowly and mindfully, you can be aware of the muscles you're using around your ankle and all the way up to the knee. Now let's go side to side. Slide the foot out and in, out. Again, you might feel this in the hip joint. Hips involved, the knees involved. And come back to your starting point. Now we're going to do our circles. So taking the foot out and to the right, back in and to the left, drawing an imaginary circle on the floor with the sole of your foot. Don't make it so big that you come off the floor. And then reverse direction, circling. And your leg might even feel tired after this. It's actually quite a lot of work, but it feels really good. And come back to center. And then from here, I'm going to move over onto my mat, so it's a little easier to slide on the rug. Extend your left leg and go ahead and hug your right knee in. And a good squeeze. And you can go ahead and straighten the leg and bend, and we're going to warm that knee joint up a little bit more. So just taking your time here, straighten and bend. And then come to straighten that leg, flex your foot. Maybe you can interlace your hands behind the leg and press the thigh into the hands. If you have a strap, so I'm going to suggest that if you don't have a strap. If you have the strap, you can go ahead and put your foot into the strap. You can make a loop with your strap, or you could just take the strap around the foot. And you want it on the ball of the foot, not the arch. And then start to turn the toes out and the heel inward slightly. So you've rotated the femur bone in the hip socket. Holding on to your strap. Start to find a straight leg, but be mindful not to lock your knees. So some of us with knee pain, we might have really tight hamstrings, and it might be really hard to find a straight leg here. You might have to really let the leg come away from you. But you want that hamstring to release and stretch these little muscles around the knee joint. Others of us may be really flexible and have knee issues, and we are in danger of hypermobility, of extending putting pressure on the knee joint by locking the knees out, which we never want to do. So be really mindful of that. Notice if your knee is starting to go in the opposite direction, which we don't want. Extend through that foot, maybe you back off a little and keep a little micro bend there. Stretching all those muscles around your knee joint. And breathe, so find the breath. And then from here, we're going to start to take the ankle and the foot over to the left. You don't have to go that far, just until you start to feel sensation here in the outer right leg, upper leg, the IT band. So feel for that stretch. You're pressing your foot into the strap. You're starting to take the leg across the body, but you don't have to go far. And breathe. So feel the stretch here now in the outer part of the leg, all the way up through the knee joint, even down to the side of your foot. Again, breathe through it. Take deep breaths. Remember, any movement causes sharp pain. You want to come out of that. That's your body signal saying, nope, this is not the right exercise for me today. Start to bring that foot back up, and then we're going to take it out to the other side. But as we drop this leg out to the right, you're going to hug your left knee in, take your left leg out to the left, and your right leg to the right. Just keeping some stability here in the lower back. If you have any SI joint issues, again, we want to be careful of that while we're stretching the inner groin here. And as you're stretching the leg, notice the sensation here from your inner groin all the way down to the inner knee now. Being careful not to lock out with the knee joint. If it's too much, another thing you can do, and now I did not say to have a block for this practice, but you could prop your leg on a block here. Stick it underneath your thigh, wedge it in as close to your hip as you can, and that will help to hold your leg up so that there's not too much pressure here. I'll show you this on the other side. Let's go ahead and bring that leg all the way back up. Release the strap. Hug the knee in. You can straighten your left leg away from you. Give it a good squeeze. And release it down. Go ahead and bend both knees. You can rest here for a moment. I'm going to switch sides. Turn around the other way. Let me grab a block and I'll show you how to support that leg. So coming onto your back, we'll switch to the other side, extending the right leg and hugging your left knee in. Maybe warming up that knee joint a little bit more by straightening the leg and bending. Circulation there, especially if you practice early in the morning. And then get your strap. Well, you can extend the leg if you don't have a strap. Interlace the hands behind your thigh and press the leg into the hands, turning the toes out slightly and the heel in slightly. And we'll talk about that a little bit more when we come back to seated for another exercise that we're going to do. So I'm going to go ahead, because I have my strap, I'm going to put that around the ball of the foot. Again, you could use a belt. You can use a dog leash, works really great because it's made of very similar material. And you can just put your foot through the end of it that you normally would hold on to. And breathe here. Be mindful not to lock your knee. If you feel really tight and you've got the knees bending here, maybe take the foot further away until you can really stretch everything. And then maybe as you find a little more mobility and flexibility, you might be able to bring that leg a little closer. So we'll come to the next movement, stretching the outer part of the leg. Start to take that foot across your body, holding onto that strap, flexing the foot into the strap, just until you feel sensation here from the outer hip all the way to your ankle, really. Breathe through it. Also try not to allow your hip to hike upwards. So you can even take your hand and press it into the top of your thigh as if you're pushing your leg away. Sometimes that's helpful. Emphasize the exhale here. finding some release, and then gently bring that foot back up. We're going to start to bring it out to the side. Now I'm going to bend my right knee and draw it in. Take the right knee out to the side as well. So I'm not bringing it into the chest this way, but out to the right. And then if this is difficult to hold on to, or you just feel a lot of pressure there at the knee, try taking a block maybe on the lowest height or the medium height, or even tilting it in towards your leg. Of course, it's not going to work for me now. There we go. And let that block support your leg. Holding on to the other guy, other knee in your other hand. Breathe here. And then gently bring that leg back up to the ceiling. Release your strap. Hug that knee in. You can extend the right leg again. Give it a good squeeze. And bring that foot back down to the floor. Let's roll to the side and come back to seated. Just to make sure I'm not forgetting anything I want to show you today. We are going to come back onto our back for bridge pose, but okay, so a couple things we want to do, seated and one standing, actually 2 standing exercises. So we're going to take that roll blanket I had you roll. This is not for everyone, but it might feel good for you. So you're going to bring that roll underneath your knees, and especially the knee that is giving you trouble, try pressing the knee into the blanket. So you're going to do one at a time. I'm not pressing both knees in. And if you're just having issues with one leg, maybe you just do this on one side. You press and release. 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 And I'm going to do 5 on the other side. Press and release. So you're pressing the back of the knee down into the roll blanket and releasing. So it doesn't look like very much. Press and release. And again, this is not for everyone. So if you've got an injury at the back of the knee, obviously this is probably not something you want to do. But you're going to feel as you press, feel what muscles are activated here. And press and release. And that's all I'm going to do today. Again, you might do 1 set of 8. You might start building up to 2 sets. From here, we want to strengthen the upper quads. So there's a couple things we're going to do for that. The first is just really simply leg lifts. You could do this in a chair. You can do it seated. So technically, this is called Dandasana, or staff pose in yoga. And again, if you're going to round into the lower back, make sure that you sit up on a little folded blanket so that you've got support. You could even be seated with your back against the wall. I'm going to come to face you again. So here's where it's going to be really important to turn the toes out. We'll start with the right leg. Turn the toes out. We want to activate this inner quadricep, the vastus medialis. So I'm going to lift that leg up and down, up and down. Maybe let it hover. Don't let it come all the way down if you can. It doesn't look like much, but let me tell you, you will feel this tomorrow. So take it easy. If you've never done this before, 6. I have, and I already did a set today, so I'm really going to be feeling it. There's 8. Woo. Pause, rest. We'll do the other side. So again, turn the left toes out that way a little bit. Lift. Imagine lifting from the inner heel up. Little pulses for 4, 5, 6, 7, 8. Release. That might be it for you today. I'm going to do one more set. So if you're feeling all right and you're ready for another set, let's go back to the right side, turn the toes out and lift. Little pulses. 2, 3, 4, 5,
6, 7, 8. Release. Shh. I want to give it a good massage here. Other side. Turning those left toes out. Lift for 2, 3, 4, 5, 6, 7, 8, and release. Sit up nice and tall. Lift from your chest. Inhale the arms up. As you exhale, hinge forward. Bring those hands to your shins or the rug. Some of you might be able to touch your toes. Little forward fold here, stretching the backs of your legs. You're also welcome to grab that strap that you have. You can place that around the balls of the feet and simply sitting up tall. Inhale, and as you exhale, again, hinge forward. Don't round into your lower back. Just stretching the backs of those legs in a nice symmetrical stretch, giving the quads a little break after that work that we did. And then from here, we're going to transition to standing. I'll show you 2 exercises standing. So you can just come up to stand, or if you'd like, actually, let me show you that little thing with a table pose first. So in yoga, if you are able to do hands and knees, you might try doing it on a folded blanket. This really helps me a lot. I have nerve pain here, and so when I fold that blanket, it's just enough cushioning that I'm able to do some cat-cows. So try it. If it's not for you, then you don't ever have to do table pose. So I'm going to tuck my toes here, walk the hands forward a little bit, spread the fingers wide, and start to lift the knees up, coming into downward facing dog. So if you're okay doing down dogs, this could be a great stretch also for the backs of the knees and the backs of the legs. If this is not for you today, and I'm going to walk my hands back to my feet. That's a great way to come out, coming into a forward fold. Bending your knees, sinking your hips back, come all the way up to rise. Now you could do downward facing dog at the wall, which, pardon me, because the best way for me to show you is going to be to turn my butt to you. But taking your hands at the wall, shoulder width apart, wrists in line with the shoulders, and then walking your feet out until the head comes down between the arms, and you have that very similar stretch to what I just did on the floor. So from here, we're going to come into a chair pose. So in yoga, again, we start from mountain pose with the feet hip width apart. And you can think of this like squats, right? Really good for strengthening the muscles around the knees. So as we start to sit in, like we're going to take a seat, make sure your hips go over your heels. You should be able to lift your toes and place them back down. Notice here, especially ladies, but anyone really, if your knees start to go in towards each other, you could take your hands to the outer knees, press your knees into your hands, sit back a little bit more, and the hands resist. That means you need a little more strength here in that vastus medialis that we just were working on. You might feel this in your hips. And gently come all the way up. So, see if you can hold that pose maybe 15 seconds. And then maybe you start with 10 and then 15 and 20 and see if you can hold a little bit longer, maybe even up to 30 seconds. If it's really hard to do chair pose standing, you can come to a wall where you've got wall support. Again, I'm starting, feet are hip width apart. My back is against the wall. My butt is against the wall. I'm going to walk my feet out until I can come to sit where my knees are pretty much in line with my ankles. The ankles are maybe slightly in front of the knees. And I'm supported by the wall, sitting up nice and tall. You're going to feel this in those quads. Again, try holding for 15 seconds. And if you don't quite make it, it's something to work up to. When you want to come out, press down through those feet gently. Walk your feet back up. And maybe come and do another set if you feel like you can do one more. So from here, I'm going to come into another standing pose, warrior one. Get these blankets out of the way. So we'll start with the right side. You can either step that right foot back, or if it's easier for you, come to the back of your mat and step the left foot forward. Sometimes that's less scary. So we're bending this front knee, and we don't want it to go out over the toes because then we're putting the weight of our body on the knee. We want to strengthen these muscles, not injure the knee. So my back foot is turned out at about a 45-degree angle, 30, 45 degrees. The heel is down. If it were turned up, I'd be more in a lunge, right? So heel down, maybe we step it in a little bit. Find your stance. If you step it in too far, guess what? My knee is going out over my toe, so I got to step back. That's your big clue. So left toes are pointing forward, right toes out slightly, hips are forward, ribs are forward. Find stability here with this front knee. Inhale, reach your arms up to the sky. Really pressing down through that front foot. And then exhale, straighten your front leg. We're going to watch how that knee tracks. Inhale, bend the knee and reach up. Exhale, straighten, come down. Inhale, bend. And exhale, straighten. So working on some strength and mobility in that front knee. Maybe you don't have as deep flexion as me yet. Maybe you're working to recover. And straighten. One more time, inhale, bend. Exhale, hands to your heart. Step the back foot forward and march it out a little bit. So let's come to do that on the other side. I'm going to turn around just so you can see that leg. I'm going to step that left foot back. So again, if you find it easier to step the right foot forward, to come from a place of standing, mountain pose, step forward. Watch that front knee right away. Mine is in line with my ankles. It's not gone out over my toe. This is actually my weaker knee. So I'm going to turn back toes out. Encourage the hips forward, ribs forward. Inhale, arms up. Notice your stability here. Notice if your knee is wobbly. Draw your belly in. So this is also really important here. Exhale, straighten your front leg. Inhale and bend and reach. Exhale and straighten. Inhale, bend and reach. Exhale, straighten. Inhale, bend. Exhale, straighten. This is the last one. We're going to bend that knee, hold. You can always bring the arms down if you want to. And exhale, step the back foot forward. Good job. Come back to standing in mountain pose, feet beneath the knees, beneath the hips, right? Hip width apart. If you want to add a little balance today, we can come to balance on our left foot. Draw your belly in, root down through that foot, start to lift your right knee up into stork pose. You can always hold on to a chair or a wall here. Reach the arms up. Notice how that affects your balance. So balance and also stability on that standing leg. And then bring that foot down when you're ready. Starting from that neutral place mountain pose. As you're ready, we will root down through the right foot, drawing the belly in. Start to bend that left knee. Lift that foot off the floor, draw your belly in, maybe reach the arms upward. Notice how that changes your balance. This is my weaker side. Root down through that right foot, draw the belly in. Keep your gaze steady. And when you're ready, release it down. Good job, you guys. Breathe. Exhale it out. We're going to come back on down to the floor. I want to end with a bridge pose. There's lots of things we could do for the knees. There's, you know, we think we're restricted when, and maybe we are restricted when we can't do certain postures, but there's always other things we can do. So come onto your back. And again, this is really important. So think about mountain pose. My knees are hip width apart, my feet are hip width apart, and the feet are under the knees, so they're not way out here. If your feet are out there and we're gonna come into bridge and lift our hips up, we're gonna be all wobbly, and it's gonna be hard to really get the quads, which we're mainly engaging our quads and our glutes here, to lift the hips up. So walk those feet in underneath the knees. Really important when we're strengthening the knees and the muscles around the knees to have good form, because if we don't have good form or we're not using the right muscles correctly, that's when we can have injury. So you want to have that stability. And then hands at your side, we'll start palms down, press down, root down through your feet, start to lift those hips up, start to lift the spine up, walking the shoulders underneath. This first bridge pose, just feel what muscles are activated here. Feel how the quads are lifting you up, glutes lifting you up. Try not to clench your glutes. We're engaging the glutes, but don't like clench them, right? We want to have a little give there. And then slowly lower all the way back down. Relax and release. So we'll do that 2 more times. Root down through your feet. As you inhale, start to lift your hips, lift your spine, walk your shoulders under. Try turning the palms up this time. Maybe you lift a little bit higher. Breathe. Really great for strengthening the muscles around your knees. When you're ready, gently roll back down till the hips settle. Turn the palms down. We're going to do 1 more today. As you're ready, press down, root down through your feet. Start to lift those hips up, 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 up. Walk the shoulders underneath, turn the palms up. You could stay here. Those of you who are able to clasp your hands underneath in a full bridge pose, feel free to do that. Make sure that the palms are together, so I'm not doing one of these things. I'm pressing the palms together. And the hands stay on the floor, so they don't come up. I've seen people do that too. Root down through your upper arms, press down through your feet, lift your chest towards your chin towards the sky. So maybe at home you time this for about 20 seconds. Don't turn your head like I just did. Slowly start to roll your spine back down. Reach your arms overhead. Exhale, draw the knees in. Rock a little bit side to side. So you don't want to turn your head in that pose. It's not good for your neck. I'm so used to having students in my class with me, and I want to come and look at you on the camera. So maybe straighten your legs up here. And then drawing the knees in. Bring the feet down to the floor. We're going to take our knees to the left. Little stretch to end with. Arm out to the side. Keep the right shoulder on the floor. Breathe. And then bring your knees back to center. We're going to shift those hips over to the left, making room for dropping the knees over to the right. Keep your right shoulder down on the floor, maybe reaching out to the right, or you could have a cactus arm. Stretching through the glutes here, the hips. So whenever we're working with knees, we typically want to, like I mentioned, we started with the feet. We want to look at the hips too. So hips, knees, feet all work together. It's all connected. Take a couple deep breaths here.
And then bringing the knees back to center. The last thing I would say, you could end here in Shavasana. You could take a little Shavasana, taking that roll blanket under your knees and lying back. Or maybe come to the wall if you have some wall space and do a little legs up the wall. And if you want to do that, it's nice to, I'm not going to move my mat, so I'm just going to take my blanket right here next to the wall. I'm going to sit real close to the wall so the side of my hip is right next to this wall. Come back onto my back. And then I like to take my hands, start to take the legs up the wall and push in. You have to kind of scoot around. Make sure that you haven't slipped away from the wall. So you want your hips right up against, your tushy right against the wall there. Backs of the legs supported by the wall. Allowing the feet, the ankles to rest. After that practice that we just did. So being mindful in this posture, if this is the counterindications here, glaucoma, hypertension, high blood pressure, if you're feeling like, if it's not treated and you're feeling really red in the face, you want to come out of this, not the best posture for that. Hiatal hernia, acid reflux, any of those things, just end in Shavasana, don't do the legs up. You could take a milder version and just put your legs on a chair where they're not so straight. But otherwise, it's nice to, again, we're ending with a supported stretch for the backs of the legs. And you could stay here as long as you like. I'm going to go ahead and bring my legs down to the side, gently walking up to end this short practice for those of you who have issues with the knees. So I hope that you find this useful. If you have any questions, please reach out. It's always great to have an individual assessment from a yoga therapist or, of course, physical therapist. So be well, take care, take good care of those joints and those knees. Namaste.